a unilateral spine frame, and a bilateral spine frame. The unilateral spine frame comes with one 16-inch rail clamp, crossbar, two 8x10 angled arms. The bilateral comes with two 11-inch rail clamps and two angled arms, 8x10. A couple of things you want to make sure first off when you get into the OR is to make sure you understand what is going to be happening up here with anesthesia. A lot of times there's tubes, wires, lines. You want to make sure there's a little bit of clearance, because once this bed rail is attached and the crossbar comes across, you just don't want any of that interference. Also, neuromonitoring will be most likely on this side, on the right side of the patient. You want to make sure that their wires aren't going to interfere with you attaching the bed rail clamp. So just let them know, the neuromonitor, is to place their wires on top. So what we're going to do is we're going to attach the rail clamp to the bed. Right here's the tongue. You want to make sure that tongue is completely receded. They can let that joint be loose, grabbing it in the middle, and then simply pull up so they know they have a good purchase on that bed rail, and then tighten down. Then using the ears to secure it. Remember, our rail clamp can go over the sterile drape. Secondly, we're going to attach the crossbar. Note, these joints are secure, they don't come off, so this counts as one. But always make sure that whoever puts this in, is you want to hang on to these joints. You just don't want it to be hitting the patient. So, crossbar is going to go into the joint on the Elite rail clamp, and usually 2 to 3 fingers is about what we say is the height above the patient's forehead. So nice and level, straight across. This doesn't turn to latch, it just simply latches upward. Make sure that's nice and level. And then when you go to latch it, you want to make sure that this latch is parallel with the Elite rail clamp. You don't want it coming forward, you don't want it going back so it's poking or in the way. Once you start attaching handles, once everything else is in place, it just can be a little bit cumbersome. Now the next step, as you can see, we have our two 8x10 angled arms, 8-inch, 10-inch. There's no right or wrong as far as how or which end to put in. The main thing is you just want to make sure, based on the patient's anatomy, if it's a longer patient, longer neck, maybe you'll just want to use the longer end. If it's a multi-level case, maybe you want to use the longer end. If it's just a one-level case, then the 8-inch end would work. So what we're going to do is we're going to put these in the crossbar joint. And the takeaway, the most key thing that we always tell every surgeon is low and wide. You don't want this too close, because once you add your handles and your blades in there, there's really no room for them to retract. So you want to create that space so their working space is nice and open and clean. So low and wide, level with the incision is a good, accurate measurement. Also, that wide is almost to the width of the table itself. So a first-time user is going to be a little cumbersome, because they're not going to know how to position these. A lot of times I will just say, by holding that elbow, it's kind of the fulcrum of the actual arm itself, so you can control a little bit better. One finger at the other end, the distal end of the arm, and then you can just move it back, forward, up, down, and out. So right now we're just going to move that out so it's nice and wide, looks level, and then latch this back. Now when I say back, we want to make sure that this isn't latched this way or this way, because you want to use this real estate within this crossbar possibly. So we'll just secure it straight back. And then for the other side, just mirror that. Also remember to keep these joints on top. So we're going to leave this nice and wide out here. Taking the latch, securing it. And now you set up the spine frame unilaterally using one Elite rail post. The two handles in the spine frame kit are our Cam 2 clip-ons, 8-inch handle, angling features, simply clips on to the angle arm, and then our micro adjustable, a much stronger handle, 7 3/4 inch long, also has the angling feature. Now with our micro adjustable, what I always like to stress is this is a much stronger handle for retraction, especially for cervical. A lot of times this is used in our liver systems or big patients. Surgeons may not like this because it doesn't give them quite that tactile feel that the Cam 2 handle does. So in most cases, I always have them start with the Cam 2 handles, and I really don't have them use this. If it's a user that has been using that Cam 2 clip-on, they're okay with it. They most likely will not go to the micros. If they've had used and experienced with the micro adjustables, then I let them go ahead and use what makes them comfortable. This just shows an alternate setup to the spine frame. You can set this up inferiorly if need be. Now let's talk a little bit about the S-Lock system. Now the S-Lock system gives them the ability to swivel or lock a blade into position, as you can see by the serrations. So it normally is how that's controlled. Depressing the nipple, putting it into the first setting gives them that swivel capability. Second, in order to lock a blade in position, they simply push down again, it'll lock in that position. So they can essentially lock the blade in any position desired. Now our blade choices in the expanded cervical set are the standard concave blade, a longitudinal. Longitudinal is good for inferior and superior retraction, molds to the spine. Tapered blades are 90 millimeter odontoid blade, ideal for C1, C2 superior retraction. And the micro blades, again ideal for a third blade choice. And our midline blades. Also keep this in mind. Standard OR beds, rails may end at the very, very edge of the table. So we do offer a rail extender that can be attached just to extend it just enough to give you that room to come over and give you that reach. But also there are Jackson frame adapters that we offer for the Jackson tables. Also Wilson tables. Wilson tables we do not have adapters for, but in most cases the hospital should have that proper adapter for that table.